Today topic of discussion fibrocystic change. Now we will discuss about fibrocystic change of that breast. Now breast disease can be classified into inflammatory, benign and malignant. In benign also we have further two categories. In this one, non-proliferative disease and proliferative disease. And now this that fibrocystic disease is used for this category, non-proliferative diseases. This is non-proliferative category of that benign breast disease. So why it is important to classify such classification? Because certain category they poses risk of increased breast cancer. So some category poses risk increased in breast cancer. So fibrocystic disease still the time it is non-proliferative. This one is the non-proliferative. It is not associated with any increase in the breast carcinoma. Now this is the disease which is seen in reproductive age. It is seen in the reproductive age group, that is the age group between 25 to 40 years, 45 years in that female. It is very common phenomenon because it is not a single entity. It is a collection of many things. It is not single entity, collection of many things. So what are the clinical features? How the patient will present? The patient will present with the breast pain. Now this breast pain will be cyclical. That means it will alter with the menstruational cycle, and then there can be tenderness of that breast, lumpiness present. So a term is used for fibrocystic disease of that breast. On palpation, how does it feel like? It is a lumpy pumpy breast. Okay, it is a lumpy pumpy breast. So there is not a very clear lump, but there is a irregular lump present which is free to move. It is not fixed, and the term is known as lumpy pumpy breast. So it can be associated with the polycystic ovary syndrome, because now that fibrocystic disease is also estrogen dependent. So the condition where estrogen level is high, it will associated, and usually this is the bilateral. Here you can see what happened, that normal breast tissue, this one. So here you can see that cyst is present. So here cyst present in the breast. Coming to that morphology, depends upon that various thing. There can be multiple things microscopically, which you can see that breast microscopically. First is the presence of cyst. First one is microscopically. First things we can find out cyst. Now if you see cross specimen, if you cut and open, you can see multiple cysts, but we don't receive specimen mastectomies. Specimen such as fibrocystic disease, because it does not have any malignant potential. Under this condition, automatically when the woman grown in that age, especially when that woman goes into post menopausal age, this condition will resolve on its own only. So mastectomy specimen are not received for this one. Microscopically you seen this one, you received that breast biopsy. Okay, breast biopsy specimen, there is a lump present, and breast biopsy is done. We are finding the cyst, presence of cyst we can find by using biopsy. Now cyst in that fibrocystic disease, they contain a semi translucent semi-translucent fluid which is brown in color. This is the straw color fluid which is present, and especially when the size of the cyst increase, you see it form that surrounding tissue. It appears slightly blue in color. Therefore, blue dome cyst. Okay, blue dome cyst. So here that word we using blue dome cyst used. This is the appearance of the cyst, and how does it look like? It is dilated, and it is lined by either flattened lining, epithelium or aphocrine cell are present. So this is the cyst part of that fibrocystic disease. Now what happen when there are the multiple cysts? What will happen? One of the cysts are ruptured. Suppose this one is cyst, means it become ruptured. When the cyst rupture, there will inside yeah, inflammatory response will be there. Whenever there is an inflammatory response, and it is chronic inflammation is going on, it will lead to fibrosis. Because of rupture, it causing chronic inflammation. Because of that, it forming that fibrosis. So fibrosis will also seen. So this is the rupture. This one is the rupture, so it formed this fibrosis. They released the secretory material into that stroma. Okay, secretory material into that stroma. This will leads to chronic inflammation. So chronic inflammation and fibrosis, and this fibrosis will leads to palpable firmness of that lump, okay, of that breast. That lumpy pumpy breast will be because of this fibrosis. Because of that fibrosis only, lumpy pumpy breast formation. Other features microscopically which you can see in next one is adenosis. Okay, third condition is the adenosis. First one is cyst formation, second one is fibrosis, third one is adenosis. If you see this adenosis here, adenosis increase in number of acini or lobes. Here we can find out increased number of acini or lobe. That means the number of gland are increased. If there is increased number of gland, it is known as adenosis. This is seen in fibrocystic disease. It is a spectrum of disease. Not all things are present, and sometimes variety of things are present in mismatched fashions. Then you can see this one, apocrine. You can see apocrine metaplasia. That means that the cells of that gland, this gland, so here this gland, you see the cell, they are very eosinophilic. And there are have abundant cytoplasm. It is known as apocrine change. That can also be seen in epitheliosis. Epitheliosis can seen. That means the cell show hyperplasia. So here there is inside high amount of cells. So hyperplasia. The epithelium, they show hyperplasia. This is epitheliosis, and also there is a chronic inflammation. Fibrosis is going microcalcification also since the fibrocystic disease. So cyst formation, fibrosis, adenosis, then apocrine metaplasia, epitheliosis, and microcalcification. All the things seen in fibrocystic diseases. So in this video we discussed fibrocystic changes in the breast. This one is the benign condition. This one is the morphological. Then microscopic view. Here increasing in gland. So microcalcification also seen. Thanks for watching.